Hi everyone, welcome back to the channel. If you're dealing with unexplained bone fractures, calcium deposits forming in your arteries, or watching your teeth deteriorate despite perfect dental hygiene, stop what you're doing and pay close attention. What I'm about to share could literally save your cardiovascular system and skeletal structure. There's a vitamin so misunderstood that 90% of Americans are deficient without knowing it. Medical research shows this deficiency directly contributes to osteoporosis, arterial calcification, and premature aging of your cardiovascular system. Right now, calcium might be silently depositing in your arteries instead of strengthening your bones, and you have no idea it's happening. Studies confirm people with adequate levels of this nutrient have 50% lower risk of arterial calcification and 37% reduced risk of heart disease mortality. That's not a small difference. That's the difference between a healthy heart and blocked arteries requiring surgical intervention. The pharmaceutical industry spent decades promoting calcium supplementation without mentioning the critical cofactor that tells calcium where to go in your body. Without this vitamin, calcium becomes a dangerous substance floating through your bloodstream, hardening your arteries while your bones simultaneously weaken and fracture. We're talking about vitamin K2. Vitamin K2 is the most overlooked nutrient in cardiovascular and bone health. Unlike vitamin K1, which handles blood clotting and comes from leafy greens, K2 directs calcium to your bones and teeth while actively removing it from soft tissues like arteries and kidneys. This isn't theory. This is documented biological function, backed by decades of research. 1 in 3 adults over 50 has dangerous calcium buildup in their coronary arteries. Clinical studies show adequate vitamin K2 intake reduces this arterial calcification and decreases cardiovascular mortality by more than 1/3. Your body produces small amounts of K2 through gut bacteria, but nowhere near enough for optimal function. Modern diets eliminated the richest sources when we stopped eating organ meats and fermented foods. Your grandparents got K2 from liver, egg yolks from pastured chickens, butter from grass-fed cows, and fermented vegetables. You probably get almost none unless you deliberately seek it out. Quick reminder before we continue. This video is educational information. Always consult your doctor before starting new supplements or changing your medication regimen. I'm providing research-based information to help you have informed conversations with your healthcare provider. Your doctor knows your complete medical history, current medications, and specific health situation. Use this information responsibly and work with your medical team. Now, you need to understand how vitamin K2 actually works in your body, because this explains why deficiency creates such devastating problems. When you consume calcium, your body needs to decide where that calcium goes. Without sufficient K2, calcium floats randomly through your bloodstream. Some deposits in your bones, but much of it settles into soft tissues where it causes serious damage. Think of K2 as a traffic director for calcium. It activates 2 critical proteins, matrix GLA protein and osteocalcin. Matrix GLA protein acts like a calcium removal system in your arteries, actively extracting calcium deposits and preventing new ones from forming. Osteocalcin works in your bones, binding calcium into bone matrix and increasing bone density. Without adequate K2, both proteins remain inactive. Calcium accumulates in your arterial walls, creating hard, inflexible vessels that restrict blood flow and dramatically increase heart attack and stroke risk. Simultaneously, your bones lose density because calcium isn't being properly integrated into bone structure. You end up with the worst possible combination: weak bones that fracture easily and hard arteries that can't flex with each heartbeat. The Rotterdam study followed more than 4,000 people for 10 years and found something remarkable. Participants with the highest K2 intake had 57% lower risk of death from heart disease and 52% reduced risk of severe arterial calcification compared to those with lowest intake. That's massive. We're not talking about minor improvements. We're talking about cutting your cardiovascular death risk in half. The Prospect study involving 16,000 women confirmed these findings. Women with highest K2 consumption showed 41% lower risk of coronary heart disease. Every 10 micrograms of K2 consumed daily reduced cardiac events by 9%. These aren't small trials. These are large population studies tracking thousands of people for years, and the results consistently point to K2 as critical for cardiovascular protection. Vitamin K2 comes in several forms, but two matter most for human health. MK4 has a short half-life of about 1 hour in your bloodstream. Your body must convert K1 to MK4, but this conversion is extremely inefficient, typically less than 10%. You need frequent doses throughout the day to maintain adequate levels. MK7 has a half-life of approximately 72 hours. It stays in your system longer, reaches higher blood concentrations, and more effectively activates K2-dependent proteins throughout your body. Studies show MK7 at 180 micrograms daily provides superior bone and cardiovascular benefits compared to MK4 at 45 milligrams daily. Both forms work, but MK7 requires lower doses and less frequent supplementation. MK4 occurs naturally in animal products like grass-fed butter, egg yolks from pastured chickens, and organ meats. MK7 comes primarily from fermented foods, especially natto, a Japanese fermented soybean product that contains more K2 than any other food source on Earth. For optimal health, adults need between 100 and 200 micrograms of K2 daily. Most people get less than 20 micrograms from diet alone. If you eat standard grocery store meat, eggs, and dairy from grain-fed animals, you get almost no K2. Grass-fed animal products contain significantly more because animals convert K1 from grass into K2 in their tissues. 100 grams of natto provides approximately 1,000 micrograms of MK7, meeting a week's requirement in a single serving. Most people won't eat natto regularly because of its strong smell and acquired taste. Grass-fed butter contains about 15 micrograms per tablespoon. You'd need more than 10 tablespoons daily to reach optimal intake, which isn't practical. Egg yolks from pastured chickens provide about 32 micrograms per yolk. You'd need 6 eggs daily from truly pastured chickens, not store-bought eggs labeled cage-free or free-range. Hard cheeses, especially Gouda and Brie, contain decent amounts, approximately 75 micrograms per 100 grams. Again, you'd need substantial portions daily. This is why supplementation becomes necessary for most people living modern lifestyles. Vitamin K2 treats and prevents osteoporosis by activating osteocalcin, the protein that binds calcium into bone matrix. Without adequate K2, you can consume enormous amounts of calcium and vitamin D without building strong bones, because that calcium never properly integrates into bone structure. Japanese studies show K2 supplementation not only stops bone loss, but actually reverses it in postmenopausal women. Women taking 45 milligrams of MK4 daily showed increased bone mineral density, while control groups continued losing bone mass. Fracture rates dropped by over 80% in the supplemented group. That's not slowing bone loss. That's rebuilding bone and dramatically reducing fracture risk. The mechanism is straightforward. K2 activates osteocalcin, which has binding sites for calcium. Activated osteocalcin pulls calcium from blood and deposits it into bone matrix, increasing density and strength. Without K2, osteocalcin remains inactive regardless of how much calcium you consume. Cardiovascular disease kills more Americans than any other cause. Arterial calcification is present in 90% of men and 67% of women over the age of 50. As calcium builds up in arterial walls, arteries lose flexibility and can't expand with each heartbeat. Blood pressure rises. Blood flow to vital organs decreases. Risk of heart attack and stroke increases exponentially. Vitamin K2 activates matrix GLA protein, which inhibits calcification in blood vessels. Studies show K2 supplementation doesn't just prevent new calcium deposits, it actually reverses existing calcification. Participants supplementing with MK7 showed measurable reduction in arterial stiffness after just 12 weeks. Arterial flexibility improved, blood pressure dropped, and calcium scores decreased. This is documented reversal of cardiovascular damage using a simple vitamin. Dental health depends heavily on K2 because teeth are mineralized tissue similar to bone. K2 activates osteocalcin in teeth just as it does in bones, directing calcium and other minerals into tooth structure. Historical populations with high K2 intake from organ meats and fermented foods had remarkably low rates of tooth decay despite no modern dental care. Dr. Weston Price documented this extensively in indigenous populations during the early 20th century. When these populations adopted Western diets low in K2, dental decay rates skyrocketed within a single generation. Modern research confirms K2 strengthens teeth, reduces cavities, and may even help remineralize early decay. Children with adequate K2 develop stronger teeth with better mineralization and significantly fewer cavities throughout life. Brain health benefits from K2 through multiple mechanisms. K2 activates Gas6 protein, which protects neurons from damage and supports myelin sheath formation around nerve cells. Myelin acts like insulation on electrical wires, allowing nerves to transmit signals efficiently. Studies link adequate K2 levels to better cognitive function, reduced inflammation in brain tissue, and lower risk of neurodegenerative diseases. Research on elderly participants found those with highest K2 intake showed better memory, faster processing speed, and reduced cognitive decline compared to those with low intake. K2 also regulates calcium in brain tissue, preventing dangerous calcium buildup that contributes to cell death and cognitive impairment. Cancer research shows promising connections to K2. Several studies demonstrate K2 inhibits cancer cell growth and promotes cancer cell death, particularly in liver cancer, leukemia, and lung cancer. Japanese research found patients with liver cirrhosis who supplemented with high-dose K2 had significantly reduced risk of developing liver cancer compared to unsupplemented patients. The mechanism appears related to K2's role in regulating cell growth and preventing abnormal cell proliferation. Women with highest dietary K2 intake showed reduced risk of breast cancer in population studies. This doesn't mean K2 cures cancer, but it suggests adequate K2 levels may help prevent certain cancers from developing. Insulin sensitivity improves with adequate K2. Osteocalcin, activated by K2, doesn't just build bone. It also stimulates beta cells in your pancreas to produce more insulin and helps your cells respond better to insulin signals. Studies show K2 supplementation improves glucose metabolism and reduces insulin resistance. One trial found participants supplementing with MK7 showed significantly better insulin sensitivity and lower fasting glucose levels after 12 weeks compared to placebo. For anyone dealing with prediabetes or type 2 diabetes, K2 supports metabolic health alongside other interventions. The optimal dose depends on your health status and goals. For general health maintenance and disease prevention, 100 to 200 micrograms of MK7 daily provides substantial benefits. Studies consistently show this range improves bone density, reduces arterial calcification, and supports cardiovascular function. For treating existing osteoporosis or significant arterial calcification, higher doses may be beneficial under medical supervision. Japanese protocols use 45 milligrams of MK4 daily, split into 3 doses of 15 milligrams because of MK4's short half-life. MK7 requires only once daily dosing because it remains active in your system for days. Most people see better results with 180 micrograms of MK7 daily than with lower doses. Take K2 with a meal containing fat because it's fat-soluble and absorbs much better with dietary fat present. Vitamin K2 is remarkably safe. Unlike many vitamins, K2 has no established upper tolerable limit because studies show no toxicity even at extremely high doses. Japanese patients safely take 45 milligrams of MK4 daily, which is 450 times higher than the minimum effective dose, with no adverse effects reported. Your body tightly regulates K2 and excretes excess without accumulation. However, K2 can interact with blood-thinning medications, particularly warfarin. If you take anticoagulants, consult your doctor before supplementing with K2. Warfarin works by blocking vitamin K activity, and supplementing K2 can reduce warfarin's effectiveness. This doesn't mean you can't take K2 with warfarin, but it requires careful monitoring and potential dose adjustment of your medication. Newer anticoagulants like rivaroxaban and apixaban don't interact with vitamin K, so supplementation is generally safe with these medications, but always verify with your prescribing physician. Combining K2 with vitamin D and calcium creates powerful synergy for bone and cardiovascular health. Vitamin D increases calcium absorption from your digestive tract. K2 directs where that absorbed calcium goes. Supplementing vitamin D and calcium without adequate K2 can actually increase arterial calcification because you're flooding your system with calcium without the mechanism to direct it properly. Studies show participants supplementing calcium and vitamin D without K2 showed increased arterial calcium scores, meaning their supplementation was damaging their cardiovascular system. When K2 was added to the regimen, arterial calcium scores decreased while bone density improved. This is why the optimal combination is vitamin D3 at 2,000 to 5,000 IU daily, K2 as MK7 at 100 to 200 micrograms daily, and calcium from food sources rather than high-dose supplements. Most people don't need additional calcium supplements if they consume dairy, leafy greens, or fortified foods. They need K2 to use the calcium they're already consuming effectively. Magnesium works alongside K2 because it's required for vitamin D activation. Without sufficient magnesium, your body can't convert vitamin D into its active form, which means calcium absorption remains low even if you supplement vitamin D. Magnesium also activates over 300 enzymatic reactions in your body, including those involved in bone formation. The combination of magnesium, vitamin D, and K2 creates optimal conditions for bone health and cardiovascular protection. Food sources of K2 should be your first approach whenever possible. Natto remains the richest source, containing approximately 1,000 micrograms per 100-gram serving. If you can tolerate natto's texture and flavor, eating it twice weekly provides substantial K2. Grass-fed butter and ghee contain MK4, with butter providing about 15 micrograms per tablespoon and ghee slightly more because water content is removed. Use grass-fed butter liberally in cooking and on vegetables. Egg yolks from pastured chickens, where chickens actually eat grass and insects rather than being confined with outdoor access, contain about 32 micrograms per yolk. Look for eggs from local farms where you can verify the chickens truly pasture. Hard cheeses, especially aged Gouda, Brie, and Edam, contain 75 to 100 micrograms per 100 grams. A standard serving of cheese provides about 25 to 30 micrograms. Fermented vegetables like sauerkraut provide small amounts if naturally fermented rather than vinegar pickled. Organ meats, particularly liver from grass-fed animals, contain moderate amounts of K2 along with numerous other nutrients. Watch for signs of K2 deficiency because they're subtle until serious damage occurs. Easy bruising suggests poor blood clotting, which relates to overall vitamin K status. Frequent fractures or bone pain, especially in postmenopausal women, indicates insufficient K2 for proper bone mineralization. Dental problems, including cavities, loose teeth, or severe gum disease despite good hygiene, suggest K2 deficiency affecting tooth structure. Calcium deposits in soft tissues, visible as bumps under skin or detected on imaging studies, directly indicate K2 deficiency, allowing calcium to accumulate where it shouldn't. Arterial stiffness measured through pulse wave velocity or ankle brachial index shows vascular calcification from inadequate K2. High blood pressure that doesn't respond well to medication may partially result from arterial stiffness caused by calcium deposits. Kidney stones composed of calcium oxalate or calcium phosphate can develop when K2 deficiency allows calcium to precipitate in kidneys rather than being directed to bones. Children need K2 for proper skeletal development and dental health. Growing bones require constant calcium deposition guided by K2-activated proteins. Children consuming modern diets get minimal K2 unless they regularly eat organ meats, fermented foods, or products from grass-fed animals. Studies show children with higher K2 intake develop stronger bones, better teeth, and proper facial structure. Dr. Weston Price documented that children in traditional cultures consuming K2-rich foods had wide dental arches, straight teeth without crowding, and virtually no cavities. When their families adopted Western diets low in K2, the next generation showed narrow dental arches, crowded teeth requiring orthodontics, and high cavity rates. For children, aim for 50 to 100 micrograms of K2 daily through food sources like grass-fed butter, cheese, and egg yolks. Supplementation can be considered for children with poor bone density or significant dental problems after consulting with their pediatrician. Pregnancy and breastfeeding increase K2 requirements substantially. The developing fetus needs K2 for proper bone formation and brain development. Maternal K2 status directly affects infant bone density and facial structure. Studies show pregnant women with adequate K2 give birth to babies with stronger bones and better mineralized teeth that erupt later in infancy. K2 transfers into breast milk, but the amount depends entirely on maternal intake. Women consuming K2-rich diets or supplements provide adequate K2 to nursing infants, supporting their skeletal development and dental health. Pregnant and nursing women should aim for at least 200 micrograms of K2 daily through diet or supplementation. Talk to your doctor before starting supplements during pregnancy, especially if you take any medications. Athletes and active individuals benefit significantly from K2 because exercise creates mechanical stress on bones, stimulating bone remodeling. This process requires adequate K2 to direct calcium into areas of high stress, strengthening bones where they need it most. Athletes with insufficient K2 may develop stress fractures despite adequate calcium and vitamin D because calcium isn't being incorporated into bone effectively. K2 also supports cardiovascular function, which is critical for athletic performance. Flexible arteries deliver more blood and oxygen to working muscles. Studies on athletes show K2 supplementation improves arterial flexibility and may enhance cardiovascular efficiency during exercise. Athletes should consider 200 micrograms of MK7 daily, taken with a fat-containing meal for optimal absorption. Elderly individuals face the highest risk of K2 deficiency because dietary intake often decreases with age, gut bacteria production of K2 declines, and calcium dysregulation becomes more problematic. Seniors commonly supplement calcium and vitamin D without K2, potentially worsening arterial calcification while failing to adequately strengthen bones. Research shows elderly people with highest K2 intake maintain better mobility, suffer fewer fractures, and show lower cardiovascular mortality. For anyone over 65, K2 supplementation at 180 to 200 micrograms daily should be strongly considered alongside vitamin D and magnesium. People taking statins may have altered K2 metabolism because statins affect the biochemical pathway that produces both cholesterol and K2. Some research suggests statin use might reduce K2 levels or effectiveness, though this remains under investigation. If you take statins, monitoring your K2 status and considering supplementation becomes particularly important for maintaining bone and cardiovascular health. Digestive issues, particularly conditions affecting fat absorption like celiac disease, Crohn's disease, ulcerative colitis, or chronic pancreatitis, severely impair K2 absorption because it's fat-soluble. People with these conditions often show multiple fat-soluble vitamin deficiencies, including vitamins A, D, E, and K. If you have digestive problems affecting fat absorption, work with your doctor to address the underlying condition and supplement K2 in higher doses or more frequent intervals to compensate for poor absorption. The bottom line is, vitamin K2 directs calcium to where your body needs it, your bones and teeth, while actively removing it from where it causes damage, your arteries and soft tissues. Without adequate K2, calcium supplementation can harm rather than help you. Population studies consistently show people with highest K2 intake have strongest bones, most flexible arteries, and lowest cardiovascular mortality. Most people are severely deficient because modern diets eliminated K2-rich foods like organ meats and fermented products. Supplementing 100 to 200 micrograms of MK7 daily, combined with vitamin D, magnesium, and calcium from food sources, provides comprehensive support for bone density and cardiovascular protection. This is documented, researched, evidence-based nutrition that most doctors still don't discuss with patients. If you're over 50, if you supplement calcium and vitamin D, If you have osteoporosis or cardiovascular disease, or if you want to prevent these conditions, add K2 to your regimen today. Talk to your doctor about appropriate dosing for your specific situation. Check your current supplements to see if they contain K2, and if so, verify the form and amount because many multivitamins contain insufficient K2 or only K1, which doesn't provide the same benefits. Consider adding K2-rich foods to your diet, particularly grass-fed butter, aged cheeses, and egg yolks from pastured chickens. If you eat natto, you're getting substantial K2 and should continue. If you can't stomach natto, supplementation becomes the practical choice. Share this information with family members, especially parents, grandparents, and anyone taking calcium supplements or dealing with osteoporosis or heart disease. This could prevent fractures, reverse arterial calcification, and potentially save lives. Your elderly relatives probably take calcium and vitamin D without K2, which means they might be inadvertently hardening their arteries while their bones stay weak. Send them this video. Have the conversation with their doctors. Remember, always work with your healthcare provider when adding supplements or changing your health regimen. This is educational information to help you make informed decisions and have better conversations with your medical team. Your doctor knows your complete medical history, medications, and specific health needs. Use this information responsibly. Thank you for watching. If this helped you understand K2's critical role in your health, hit that like button to help this information reach more people who need it. Comment below and let me know. Are you supplementing K2? And if so, which form? Your comments help others learn. Subscribe and turn on notifications for more evidence-based health information you can actually use. No hype, just research and practical guidance. Stay healthy. Stay informed. God bless.